Good afternoon, everyone, and welcome to the COVID-19 update for Thursday, November 19th. Dr. Ezike and I are by Dr. Kamal Singh, an infectious disease specialist with North Shore University Health System, who has worked to care for hospitalized COVID patients since the beginning of this pandemic. Tomorrow will be the first day of our statewide Tier 3 mitigation efforts. Outside of things you have to leave home for, like school, work, and groceries, we're asking everyone to stay home as much as you can. This is a temporary thing that we can do to reduce the spread of this virus in our communities. That will give our healthcare workers some relief and ensure that there will be hospital beds and doctors and nurses available for emergencies. One thing you can do to further assist our hospitals is to donate blood. Fewer people than usual are giving blood during this pandemic, yet there are still patients in need of transfusions, including those who need surgery, are undergoing cancer treatments, have chronic conditions such as sickle cell, or for those who experience accidents or trauma. Blood collection is especially low around the holidays in normal times, and then add a pandemic on top of that. We need your help. As you all already know, here in Illinois, the state has provided contact tracing grants to the 97 local public health departments, where they are in charge of their counties and cities' contact tracing efforts for COVID-19. The advantage of this localized approach is that it allows neighbors to reach out to neighbors, offering localized services and answers for those who are isolating in their communities. In that same spirit, we'll be bringing on a network of pandemic health navigators, community-based organizations tasked with connecting those who are infected or exposed to COVID with critical services and resources such as meals, medicine, mobility assistance, mental health resources, supports that are especially vital during isolation and quarantine. These navigators will be especially important for our most vulnerable populations. Among other things, these organizations will do everything from assisting with public benefits applications to supporting health literacy, from combating COVID rumors and myths to promoting everyday preventive actions. Whatever it takes to reduce the disparity in outcomes shouldered by marginalized communities in this pandemic. I'm proud to announce today that we're sending $60 million in funding out the door to our 2 regional coordinator organizations. They, in turn, will award grants to community-based groups who do this work on the ground. These grants will cover the entire state except Cook County and Chicago, both of which directly receive funds from the federal government to manage local programs of their own. OSF Healthcare System, already a great partner to the state in our COVID-19 telehealth program, will coordinate this work in our Restore Illinois Region 1. And the Illinois Public Health Association, with a special focus on federally qualified health centers, will coordinate efforts in Regions 2 through 9. Both organizations will be bringing on numerous local partners to support those who need assistance. They will also help us reach some of our most at-risk groups in this pandemic. That includes rural communities, Black and brown communities, elderly residents, people at or near the poverty line, undocumented immigrants, people experiencing homelessness, LGBTQ individuals, people with disabilities, disconnected youth, people with limited English proficiency, really anyone who has few existing support mechanisms that could benefit from a little help navigating this pandemic, because nobody should have to go this alone. Through this partnership, these groups will receive direct funds from our regional coordinators for additional hiring. So we'll be creating jobs while we're addressing our public health challenges. If you're a leader of a deeply rooted grassroots organization outside of Cook County who might be able to take on this work, we have a link on our Department of Public Health website to submit your information to our regional coordinators. Just visit dph.illinois.gov/COVID-19. And you'll find on that website the Regional Health Navigator Interest Form under the Contact Tracing subheading. These groups will be part of our Illinois Contact Tracing Collaborative, so they can also assist our local health departments with their contact tracing workload in times of surge. We continue to see concerning trends statewide in our hospitalization data, but in the most recent 2 or 3 days, we've seen a hint of leveling in new cases and positivity rates in most of our regions. It's too early at this point to determine if this stabilizing of the average is a meaningful trend or an anomaly, but we're glad to at least have a pause in our upward movement. That doesn't mean, of course, that our work to slow the spread is any less important. These numbers are still extraordinarily high. And today's new cases won't show up in our hospitalization data, which are still trending poorly, for a number of days, maybe even a week or more. Let's take these next few weeks, and really commit to making a change for our healthcare workers, for our neighbors, for ourselves, and for our families. And while we know it's in part all of these concerns that are driving an interest in testing, I'm proud that here in Illinois we prepared our testing infrastructure for a surge and are seeing the results of that work now, with our testing reaching record heights. Illinois is now averaging a 6-digit 7-day testing average, now above 101,000 tests on average per day. This comes as today we report our second highest single day of testing ever at 113,447. Remember, you can't test your way to safety in a pandemic, but we're doing everything in our power to expand testing availability to make sure that it's there for you and your family when you need it, so you can get the answers that you and your family need and do what it takes to keep others safe too. You can find the nearest site for testing at dph.illinois.gov/testing. Thank you, and I'd like to turn it over to Dr. Ngozi Ezike.
Good afternoon, everyone. Every day we provide the number of tests that were reported in the past 24 hours, and as the governor just mentioned, today more than 113,000 tests have been reported for a total of almost 9.5 million tests since the beginning of this pandemic. And we've been seeing the number of tests steadily increase, which is great, and I want to encourage everyone to continue to pursue testing. It is through testing that we actually identify the virus and identify individuals who may have been exposed so that they can quarantine and prevent further spread. However, as the governor just mentioned, I have to remind you that if you've been in close contact with someone who has tested positive, you do need to quarantine for the full days. Getting a negative test result at day 4 or day 6 or even day 9 does not mean that you no longer have to quarantine for the remaining days. It can take in some instances up to 14 days for the virus to express itself in an individual and register a positive test. So even if you got tested every single day from the date that you were exposed, you could receive a negative test on day 1, 2, 3, all the way up to day 10. But then on day 11, you could test positive then. And that's the reason that we say that you have to maintain this quarantine. Of course, we know that most people will show up positive earlier, but we don't want to take that additional risk. If you've been in close contact with someone who has tested positive, please quarantine for that full 2 weeks. I've been hearing people talk about wanting to get tested in advance of the Thanksgiving holiday, hoping that if they test negative, that means that they're good to go and okay to gather with friends and family, including their elderly relatives. That only works if you haven't exposed yourself to anyone in the 14 days from when you got tested to when you meet up with your friends and family. So when you are around other people, you can be exposed to the virus at any time. So while I do want to encourage people to get tested, just remember a negative test does not get you a free pass to celebrate Thanksgiving in person. The safest way to celebrate with your loved ones and your cherished elderly relatives is to do it virtually. Today, we are reporting 14,612 new cases and 168 additional deaths. That includes individuals in their 30s, 40s, 50s, as well as individuals over 60. This brings the total number of cases in Illinois to 621,383, and the number of deaths to 11,178. Overnight, 6,037 individuals were in the hospital with COVID-19. Of those, 1,192 were in the ICU, and 587 were on ventilators. My fear is that the number of cases, hospitalizations, and deaths will spike even further in the weeks after Thanksgiving because people spent that holiday together, mixing households. I don't want anyone to have to look back and say, if only we didn't have people over for Thanksgiving, such and such might still be here for New Year's or Christmas. Year like no other, and as Thanksgiving holiday when a safe and effective soon, the quicker we can then get back to normal. Please, let's do what we know is right. We're almost there. Celebrate in person with those in your household and virtually with others, and we will look forward to much normal celebrations in the years to come. Thank you.